to the aspect of family planning and contraceptives. But just how then do we balance this so that we avoid the side effects, if there are any? Again, I insist, because I have also hosted, gynaes who've argued that there's really nothing much in terms of, side effects from contraceptives. I don't know whether Dr. Ignatius Kibe, who is the one that we have this morning, will be of the same view or will have the same view. So as we discuss this, we'd love for you to be part and parcel of the conversation. As I have said, the hashtag is Morning Cafe at Linda_Alela at tv47k is how you get to interact with us. 22047 is the SMS short code. We sample some of your comments as we continue. You can as well call us live. The numbers will be running down on your screen just so you would ask that question, and Daktari will definitely get to answer the same. Even before we get to the types of contraceptives and the side effects, we all are privy to what has played out during this time of COVID-19. We have seen our young girls getting pregnant left, right, and center. The numbers are high. A majority of them have had to, quit school. A majority of them have had to go into forced marriages. A majority of them are out there struggling. A young girl struggling with a young baby. They do not know how to go about it. It's been quite hectic. The reports are out here begging the question as to whether we should introduce these young girls at a very tender age to contraceptives. Daktari will be telling us that. Of what benefit will it be, or of what damage will the same be? Good to have you, sir.
Thank you very much, Linda.
After a long time.
Oh yes, I missed you.
I missed you more. And I was like, I looked at the poster and I said, yeah, Daktari is coming over with a vast of knowledge in regards to what we're discussing this morning.
Yes, I heard you. And I wish to say that whoever is saying that the contraceptives do not have side effects, to go and study what we call mechanisms of action of every drug. When you take a paracetamol tablet,
it has.
Where does it go? How does it work? How does it select the headache? The minute you do that with the contraceptives, the mechanism of action, things we call pharmacokinetics, things we call pharmacodynamics, things we call biotransformation. When you say a contraceptive has been taken by mouth or by injection, how does it work to stop possible conception? So this is a big question. The minute you answer that mechanism of action, then you'll know even an engine of a car, how does it work? How does it pull the whole heavy 2-ton car forward? The minute you know the mechanism of action, then you know there are very many side effects of contraceptives. Now, more particularly, Linda, when you talk about a young girl, a small girl, and small is relative, probably somebody 13, 14, onwards to 16, that's when she's developing her secondary sexual characteristics. Okay. And now let's start from there. What makes up the contraceptive apart from, of course, the kawaida ones? The kawaida ones are CD. It's also a contraceptive.
It is, yes.
Another kawaida one is probably a coil. It's an ordinary simple coil without any drugs that have been placed on it. So they work by reversing womanhood. Reversing womanhood in that they have hormones, they are hormonal. When something is hormonal, it means it's going to work against or to assist other hormones that are within the body, what we call endogenous hormones. Yeah. So contraception is when we reverse your womanhood. When you are probably doing your, because of estrogens and progesterones, you are developing your breasts. When you are 16, 14 and below, you are developing your secondary sexual characteristics. You are getting your hair in various places. Okay. You are getting the sizes, the proper sizes of the uterus. You are getting the proper sizes of fallopian tube. You are growing. You're growing both externally and internally, what we can see and what we cannot see. So when you do it, when you are rather too young, and here I'm answering you on the girls who became pregnant when they were 13, 12, and 15, if you interfere with that process by giving a contraceptive, you'll stop the girl in her own steps with the milestones of becoming a woman. You are stopping womanhood. You are stopping, for example, proliferation of the internal side or portion or endometrium. I always give this demonstration: endometrium of the uterus, where the baby sleeps, which is a layer, sometimes up to 1 centimeter layer of a very beautiful blanket where the baby develops. So when you give contraceptives, you stop that.
Okay.
When you give contraceptives, you stop, like I said, development of your breasts. You stop probably the development of the size of the uterus itself.
So, okay.
You stop development of eggs, what we call ova, in your body. There is a process we call oogenesis.
Okay.
So when you stop, when it is rather too early, it means the girl will never get breasts.
How then? Because there are some of them that have effects in the essence that you find, like for instance, the breast will enlarge. This girl will become bigger when they are taking this, especially with the likes of the implants. So then that's, what exactly is that?
So this now shows you that you are interfering,
okay,
even growing
with the normal
bigger.
Growth. All right.
You're interfering with the normal growth. It means that there are side effects. And I said, and I repeat, some of the family planning pills that are laced with products like levonorgestrel. These are family planning pills that mimic the ordinary progesterone in the body. And progesterone is responsible for making a baby comfortable. So you are giving something that tells your body, cheats your body actually, that, oh, I'm already pregnant, so don't bring another child.
Okay.
So when you are cheating, when you are telling a lie, it's like a drunkard old man who is very poor getting an imagination that he's rich and telling people, I'm very rich. Yet people know him, he's not rich.
Okay.
So you are telling your uterus to tell the rest of the body that I'm already pregnant.
Okay.
Now,
therefore, there's no room for another baby.
So there is no room for another baby. That's the mechanism of action. The other one is, it goes to the brain. It goes to the central nervous system. It goes to a place that we call the pituitary gland. It goes to another place up there called the hypothalamus. And anything that goes to the brain in the form of a hormone, it interferes with the whole system, the body system. That's why you get now side effects, including quite often bleeding too much or not bleeding at all.
Okay.
Getting clots and sometimes getting no blood at all.
So how do you balance that? Because it's something that is quite hectic for the girls. They'll tell you for free. I mean, especially for the married women who probably would want to get into contraceptives genuinely because of the stages that they're in life, and there's so much bleeding that it's uncomfortable, and sometimes it is smelly, and sometimes it's a discharge, sometimes there's no bleeding at all, and therefore there's so much fear that comes along with that.
Absolutely. Let us start with the last statement that you've just made. We call these people